Hello students, today let's discuss about the vertical and lateral fusion defects of vagina. Before discussing the defects, let's see the development of Mullerian duct. Okay, let's start from the development of Mullerian duct. Development of Mullerian duct. So what is the other name of Mullerian duct? Guys, the other name for the Mullerian duct is paramesonephric duct. Okay, the other name for the Mullerian duct is paramesonephric duct. So why we are calling the Mullerian duct as paramesonephric duct? Okay, so I will show you the reason why the Mullerian duct is known as a paramesonephric duct. Guys, once concentrate. Okay, now I am showing you structures, okay, which are going to form the ovaries in females. So what are these? These are the gonads. Okay, now all of you, those who are seeing this, you know that these gonads are derived from genital ridge. Okay, now gonads are derived from the genital ridge. So these are the gonads. Now after that, see, lateral to the gonads, we are having two ducts. So these ducts are known as Wolffian ducts. Okay, so these are, okay, which I am highlighting in orange. Okay, they are Wolffian ducts. Okay, now important point is Wolffian ducts are also known as, what is the other name of Wolffian ducts? Wolffian ducts also known as mesonephric ducts. Mesonephric ducts. Okay, please keep this point in your mind. Mesonephric ducts. Now lateral to the mesonephric duct, please, I'm just highlighting it. See, once please concentrate. Lateral to the mesonephric duct, we are having Mullerian ducts. Okay, so these which I am highlighting in multicolored, these are known as Mullerian ducts. Okay, now what is the other name for Mullerian duct? Mullerian ducts are also known as paramesonephric duct. What is meant by para? Para means side. So as these ducts, our Mullerian ducts, as they are lying side to the mesonephric duct, also known as Wolffian duct, so we are calling the Mullerian duct as paramesonephric duct, which means they are lying side to the mesonephric duct. Okay, please keep that point in mind. Okay, now what are the important MCQs you have to keep in mind? Okay, what are they? Now these Mullerian ducts, they are two in number. Now they are going caudally. Okay, they are growing caudally. See, this Mullerian duct, this is the Mullerian duct, it has the cranial and caudal end. They will grow caudally and they will cross the, if you see this diagram, it's very clear. These Mullerian ducts, they are crossing the Wolffian ducts and they are fusing. After crossing the Wolffian ducts, these Mullerian ducts, they are fusing. Okay, now Mullerian ducts, they are two in number. They are also known as paramesonephric ducts. They will cross Wolffian ducts. They will cross the Wolffian ducts and fuses in midline. Okay, fuses in the midline. Okay, now please guys, now concentrate. This is a very important area. Let me show you only paramesonephric ducts or Mullerian ducts. Please concentrate. This is a one paramesonephric duct. This is the other paramesonephric ducts. Okay, they are both fusing it caudally. Okay, now what I just want to keep in your mind is, see, this part which is not fused, okay, these parts which are not fused, they will form fallopian tubes. Okay, so it forms one fallopian tube and this side it forms the Next fallopian tube, that's the second fallopian tube. Okay, two fallopian tubes will be there, right? So if this is the right side, okay, right sided fallopian tube will be formed by this structure, okay, which I am highlighting. This structure will form the right sided fallopian tube, and this is the left sided fallopian tube. Now, so this structure which is fused here, so this structure, now please concentrate this part. Okay, this part of the fused Mullerian ducts, it will form what? It will form uterus. Okay. Next, so this part, it's going to form what? It will form cervix. Now this fused part will form the vagina. Okay. Now vagina, the two upper 2/3 of the vagina is formed from the fused part of the Mullerian ducts. Now, please remember, even in our previous videos, it was very clear that fallopian tubes, uterus, cervix and upper 2/3 of the vagina is formed from the Mullerian ducts. Okay, here in this diagram, it's very clear. But the gonads, so these gonads, they are formed from, they are derived from the genital ridge. Okay, now, please concentrate. The upper 2/3 of the vagina is formed by the fusion of the two Mullerian ducts. But what about the lower 1/3 of vagina? The lower 1/3 of the vagina is going to form from a structure known as urogenital sinus. Urogenital sinus. This urogenital sinus, it will grow upwards and the Mullerian duct is coming downwards. So they will fuse and form the complete vagina. Okay. Now see, please concentrate here. This is the downgrowing Mullerian duct which forms the upper 2/3 of the vagina, and this is the upgrowing urogenital sinus. So they will fuse and forms the entire vagina. For the proper formation of vagina, the downgrowing Mullerian duct and the upgrowing urogenital sinus, they have to fuse and they have to canalize so that a proper vagina will be formed. Now let's discuss about the vertical fusion defects of vagina. Vertical fusion defect of vagina. So what does it actually mean? Vertical fusion defect of vagina is a condition where there is a failure of fusion of Mullerian duct with the upgrowing urogenital sinus. So if they don't fuse properly, what happens? See, if they don't fuse properly, imagine that this is a Mullerian duct which is growing down. Okay, which is growing towards the downside. Now this is the urogenital sinus. Now if they don't fuse properly, what happens? You will be left with the septum, vaginal septum. So here now you are seeing this is the vaginal septum. Now this vaginal septum, is it transverse or longitudinal? So this is the transverse vaginal septum. So what is the vertical fusion defect of vagina? Vertical fusion defect of vagina is failure of fusion of Mullerian ducts with the urogenital sinus. Okay, please keep this point in mind. So finally, what is the single important MCQ you have to remember? It is vertical fusion defect will gives rise to transverse vaginal septum. Okay, now this vertical fusion defect will gives rise to transverse vaginal septum. Okay, please don't forget. Next, if a female is having this transverse vaginal septum, then how she is going to present to the clinic. Okay, what are the clinical features in a female who is having this transverse vaginal septum? Now, if a female is if she is having this kind of septum, please understand. Now she is having, see, this is the entire vagina. In her vagina, there is a transverse septum. Okay. One more important MCQ. Most of these transverse vaginal septums, they are present at the upper part of the vagina. Okay, usually at the level of external os. Okay, near the cervix. Most of these transverse vaginal septums, they are like high septums. Okay, they will be present at the external cervical os. Okay, that's the important MCQ. Please keep that point in mind. Okay, let's continue. See, if she is having this kind of a septum, how she is going to present to the clinic? Especially when she attains puberty. At puberty, what happens? Usually a female who have attained puberty, now she is going to have her normal regular menstrual cycles. Okay, normal periods will be there. But as this female is having this septum doesn't allow the shedded endometrium to come out, so that she will present to the clinic with the main complaint of primary amenorrhea. Okay, the first important clinical feature is primary amenorrhea. Okay, so primary amenorrhea is the chief complaint. But is it actually amenorrhea? Is she really not having her periods? No, she is having periods, but they are hidden. So these are hidden periods which are known as cryptomenorrhea. We can call it as cryptomenorrhea, which are hidden periods. Okay, these periods are not showing up. Now, guys, remember, one important feature is amenorrhea. Why? Because of this transverse vaginal septum. Now, what are the other possibilities? See, if she is having such septum, okay, this is the vagina. Vagina is in connection with the cervix. Now that cervix, just I am showing in a rough diagram, which is not technically correct. Okay, anatomically it's not correct, but it's just a rough diagram. Now, please understand, here is our septum. Okay, let me show you the septum with a different color. This is our septum. Now this septum is not allowing the contents, okay, especially this menstrual contents. These menstrual contents are not going to come out. So this blood is going to accumulate here. So the blood accumulation in the vagina, this is known as hematocolpos. Okay, now the female is going to present with hematocolpos. So what happens? Gradually this blood is going to accumulate over the months. Now these hematocolpos, if there is too much of blood accumulation, it will goes to hematocervix. Okay, now the blood is even accumulating in the cervix. After some time, what happens? Even the blood is accumulating in the uterus. So this is hematometra. What exactly is hematometra? Blood accumulation in uterus. Okay, blood, okay, in uterus, blood in cervix. Hematocolpos means blood in vagina. Okay, please keep that point in mind. So even if it's continuing, okay, so what happens? Even the blood will also accumulate in the fallopian tubes, which is known as hematosalpinx. Okay, so all this can be possible. That's what I want to put in your mind. So as the blood is not coming out, it's accumulating in the vagina, cervix, uterus and fallopian tubes. Now guys, just tell me, blood in fallopian tubes. Now please tell me, if the blood is accumulating, what happens? All these structures, they will get distant, they will get bulged. So that if these uterus, cervix, fallopian tubes and vagina, they are distending, what happens? They will compress the nearby structures. So now because of this, there is distension. Now this distension, what it will do? Compress nearby structures. What are the nearby structures? In the anatomy of the female reproductive tract, it was clearly given. Okay, we have clearly discussed that anterior to vagina, what are the two important structures present? Urethra and the urinary bladder. Now this urethra and urinary bladder will be compressed because of this hematocolpos, hematometra, hematosalpinx and hematometra, hematosalpinx, and because of these structures. Okay, because of this there is a distension, and this distension is going to compress urethra. So this urethra, and even sometimes urethral sphincter. Okay, urethral sphincter, internal urethral sphincter. If these structures are getting compressed, the sphincter is getting compressed, urethra is getting compressed, what happens? Urine is not going to come out in this female. So it will lead to urinary retention. So even the female can have a clinical feature of urinary retention. What is the first clinical feature? The main chief complaint is a primary amenorrhea, which is not actually a true amenorrhea. It's a cryptomenorrhea. Menses are happening, but it's not showing up because of the transverse vaginal septum. Okay. Now other possible features, because of this distension due to the blood accumulation, it can present as urinary retention. Okay, why? Because the urethra is getting compressed. Now, what are the other features? But guys, just tell me, is this female will be having her normal secondary sexual characters? Is there any problem with her normal secondary sexual characters? There is no problem with her secondary sexual characters. Why? Because absolutely ovaries are normal, estrogen is getting produced, even ovaries are making the testosterone. So normal secondary sexual characters like breast development, pubic hair, axillary hair, they are absolutely normal. Okay, remember, this patient will be having her normal secondary sexual characters. Okay, secondary sexual characters are normal. Okay, don't forget. Now, guys, what about her pain? Is she going to have her normal menstrual cycles or not? She will be having her normal menstrual cycles. Okay, every month she is having shedding of the endometrium, but it's not getting expelled out because of the transverse vaginal septum. But she is having normal menstrual cycles. If she is having normal ovulatory menstrual cycles, will she be having pain or not? Because of the uterine contractions, definitely she will be having pain. So whenever she is presented to the clinic, she will say, doctor, I am having a normal secondary sexual characters, everything is absolutely normal, but I am already 15-16 years, I am not having my menses started, but every month I am having this lower abdominal pain, back pain. Okay, she is going to say that I am having monthly cyclical pains. So this female will have monthly cyclical pain. Okay, so she will be saying that I am having my back pain, something like that. Okay, so these are the important clinical features. Okay, don't forget. Okay, 4 important clinical features are the amenorrhea. She will present with amenorrhea. Sometimes because of this distension of these structures, she can present with the urinary retention, and the secondary sexual characters in these females are absolutely normal, and she will be complaining that she is having a monthly cyclical pain. Okay, now as a doctor, how you are going to treat this patient? Now you will be doing resection. Okay, now you will be doing the resection of vaginal septum. Okay, you are going to take out the septum and you are going to reanastomosis. Okay, you are going to do the reanastomosis, the resection of resection of this vaginal septum, and again you are going to do the reanastomosis. What you are going to do? See, this Mullerian duct, they have formed the upper two-third of the vagina. The urogenital sinus form the lower two-third of the vagina. Okay, it's absolutely normal, but there is a septum. You need to take out the septum and you need to again connect them back. Okay, so reanastomosis. Okay, so this is what you are going to do for the treatment. Now, guys, remember, Mullerian ducts are going to form the upper two-third of the vagina. Urogenital sinus is going to form the lower 1/3 of the vagina. Okay, upper 2/3 is Mullerian ducts, lower 1/3 is urogenital sinus. If they don't fuse properly, there is a transverse vaginal septum forming. Okay, transverse vaginal septum forms whenever there is a defective fusion. Now, try to understand this. Okay, so now we are mainly talking about the lateral fusion defects of the vagina. Please concentrate. So, what exactly is lateral fusion defects? Lateral fusion defects of vagina. So, what exactly is this? Now, this Mullerian ducts, see, this is one Mullerian duct and this is the other Mullerian duct. They have to fuse, okay, and this fusion, for example, I am showing you, this is one duct and this is the other duct, okay, they have to fuse, and this this septum which is present, that should be dissolved, and so that you are going to have one tube. Okay, ultimately you will be having one tube, and this tube is going to form the uterus, cervix and vagina. But if they fail to fuse laterally, what happens? They fail to fuse laterally, so this septum is going to persist. So it will form what? It will form the longitudinal vaginal septum. Okay, so whenever they are not fusing properly, especially laterally, whenever they are not fusing laterally completely, so there will be a septum present. Okay, this is the longitudinal vaginal septum. So longitudinal vaginal septum is due to failure in fusion of Mullerian ducts laterally. Okay, so lateral fusion defects will cause longitudinal vaginal septum. Vertical fusion defects will cause the transverse vaginal septum. Okay, so the topic is very clear. Okay, please once go through this topic. Okay, later we will be discussing about the uterine anomalies, congenital uterus anomalies we will discuss in the next video. Thank you.